This is a general disclaimer. Redlands Community College attempts to have the most accurate and up-to-date information listed in its content and delivery. However, your education is your responsibility. Redlands Community College or Roy Smith makes no guarantee in the accuracy of this information in this video and accepts no liability for the informational video. The information expressed is strictly the opinion of the author and the presenter, which is listed in the reference near the end of the video. This information is designed to supplement your own education or initial education and should not be used to replace any current academic program you're enrolled in. View the information and content at your own risk. Thank you.
This is going to be Chapter 27, Infectious Diseases, Fever. Key concepts. Upon completion of this chapter, you will understand how the factors in the chain of infection combine with the presence of a hospitable host to lead a patient to develop an infection. The methods used by the body to prevent infection, and that would be including barriers, inflammatory response, and immune response. The recognition that elderly patients are susceptible to infection may present with differing signs and symptoms than their younger counterparts. Chief concern. Infection. Sources of infection are things like pneumonia, urinary tract infections, or skin breakdown, and an attack of microbes. Classification of microbes. Microbes that produce disease are called pathogens, and there's several of them. Worms or helminths, parasites, funguses, protozoas, bacterium, which are single-cell unicellular life forms, viruses. Unlike any fungus or bacterium, it is not an independent life form. It requires a host in order for it to be able to grow and reproduce. Prion is on that list as well. Consists of a protein which infects cells in a manner similar to a virus and tends to affect the nerve cells whenever doing so. A prion, an example of this would be mad cow disease. Infection. Chain of infection is an important concept. A series of events that must occur between a source and a host before the infection occurs. Infectivity is a pathogen's ability to cause infection. Factors are how much of the infection did you get exposed to, what's the virulence of the infection, and the host's resistance to the disease. Turbidity in urine, sign of urinary tract infection caused by bacteria suspended in the urine, making the urine cloudy or hazy. Innate immune system has cells that respond to all pathogens, and they respond to chemical mediators called cytokines. The complement system helps the body continue the antimicrobial attack by marking invading microbes. So these guys kind of mark the infection so that the immune system can attack it. Opsonization, coating invading microbes, is what opsonization is. These are terms that you'll find in this section. Adaptive immune system, antibody system, uses specialized cells called antibodies. The antibodies themselves are created by B lymphocytes along with the T cells, and they're programmed to attack a specific pathogen with specific proteins. And what these proteins do is they make the bacteria very palatable to the macrophages. Host resistance, the patient's ability to withstand an infection. Pathogenesis is the ability of a pathogen to cause an infection. Dose, physical number of microbes present. Inoculums, the microbe introduced into the body is an inoculum. Virulence, fitness of the microbe to survive and thrive in a host. Attenuated is a weakened and more easily overcome by the host's defenses. So an attenuated virus would be a virus that essentially had its teeth clipped. Morbidity, the number of infected individuals, and mortality, which is the number of deaths caused by infection. This is figure 27.2, chain of infection, and we have to have all of these in place. So first of all, we have to have a pathogenic organism, a microorganism with the ability to cause disease. That's what a pathogenic microorganism is. Next thing we have to have is a reservoir, a place the microorganism can thrive. 3 on this, which is right here. Means of escape, a place of exit for the microorganism to leave the reservoir. Mode of transmission, method of transfer by which the microorganism is carried from one place to another, a means of entry, and this would be in the person's body, a portal allowing the microorganism to enter into the host, and then last but not least is the host susceptibility. A person who cannot resist the invading infection would be a susceptible host. And this is figure 27.3, infectious process. There's a certain incubation period that the disease proliferates in the body. And then once the patient becomes infectious, which is this up here, they can spread the disease to other people. The incubation period is also called the latent period. And the infectious stage is the period of communicability, which means that they can pretty much give it to somebody else. There are hosts and tons of diseases. These are infectious diseases. This is a table in your book, 27.3, common infectious diseases. Please look over them. We're going to talk about a few of them here. Respiratory diseases. We can include the common cold. Causative agent on this is a virus, or from the rhinovirus or coronavirus family. Pediatric RSV often starts as a low-grade fever, runny nose, and cough, but it can progress to bronchiolitis, an infection of the bronchioles that typically presents with wheezing. Influenza, caused by the RNA virus. Classic example of zoonotic disease, any disease that is transmitted from an animal to a human, which would be the flu. Pandemics come to mind. This is also in your book under this section. Infectious diseases that is contagious and affects a large portion of the human population. Constitutional signs, signs that indicate a general illness but are not specific to a certain disease. And that's because most people that come down with the flu have malaise, achiness, low-grade fever to start off with, maybe even no fever at all. We have various signs or various different types of flus, like Haemophilus influenza, bacteria that lives in the host in the upper respiratory tract and only becomes problematic when a viral infection weakens a host. So this is kind of an opportunistic bacterium. Streptococci, this is a bacteria as well. Causative agent of strep throat and is responsible for a number of other medical ailments, from dental caries or cavities to meningitis. Yersinia pestis, more commonly known as Black Death, airborne disease that was thought to potentially be the cause of the Black Plague, and signs and symptoms of Yersinia pestis are going to be bloody sputum. Tuberculosis, wasting disease, also called consumption at one point. High mortality rate caused by an aerobic Mycobacterium tuberculosis. We get several signs and symptoms from tuberculosis, including night sweats and lymphadenopathy. Night sweats, drenching diaphoresis, thought to be due to the body's immune response to the infection. Lymphadenopathy, tuberculosis enlarged the lymph nodes in the cervical chain. So lymph nodes in the neck will be large, very large. Night sweats, fever of unknown origin, productive cough, if it's active, things like that. Pediatric respiratory diseases include croup, syndrome of symptoms associated with laryngeotracheobronchitis. The thing is in croup, we tend to get a seal-like cough from patients with croup. It's a responsiveness of their upper airway. Closing of the airway provides PEEP, so whenever their bronchial tubes are inflamed, their upper airway closes a little bit, and that gives them a seal-like cough. Pertussis, whooping cough, caused by inhalation of an airborne droplets containing the bacterium Bordetella pertussis. Epiglottitis is also a consideration when looking at pediatrics, which is pretty much a focused infection of the epiglottis. Gastrointestinal diseases. Symptoms complexes associated with gastrointestinal infection are also called gastroenteritis, and they include things like cholera, infection caused by a bacterium Vibrio cholera, dysentery, blood in the diarrhea, Shigella, an infection with Shigella, Amoebic dysentery. Most common etiology of amoebic dysentery is a protozoa in your intestine. Clostridium difficile, or C. diff, bacterial infection of the intestinal tract that creates colitis-like conditions. Giardia, protozoan parasite that is barely visible to the naked eye. Cryptosporidium, protozoan parasite, the source of diarrheal infections, and it is transmitted in contaminated water. Borreliasis, or Lyme's disease, woodland disease spread by the common deer tick. Food-borne illnesses resulting from an ingestion of foods that cause disease, E. coli being one of them. Bacteria commonly found in the large intestines. They can be pathogenic if passed on to another person. Primary source is beef or dairy cows. Salmonella. This is caused by the bacteria Salmonella, transmitted by raw eggs, uncooked chicken, egg-based foods, mayonnaise, potato salad, egg salad. Food intoxication. Results of overproliferation of naturally occurring bacteria as a result of poor food storage. Staph aureus can be in this. Botulism. This is carried by the bacterium Clostridium. Botulinum, more common before modern food processing. Modern food canning uses a quick cook process to 121 degrees Celsius for 3 minutes to neutralize any botulinum before the food is canned. And then food poisoning. Campylobacterium jejunum is a result of gut contamination with the bacteria Campylobacterium jejuni from ingestion of raw milk, hamburger, or shellfish. And unambiguous bacteria found in most farm animals, and particularly chickens. So any of these get into your gut, causes inflammation or GI tract inflammation from the cellular-mediated response, could give you vomiting, diarrhea, night sweats, the whole 9 yards. Acute hepatitis results from several separate viral infections. Similar impact on the liver, and they include hepatitis A, which is transmitted via fecal-oral route, most prevalent in developing countries with poor sanitation and wastewater treatment. Hepatitis B, transmitted via either blood or bodily fluids. Big concern for the paramedics. BSI would always be a consideration in this. Hepatitis C, blood-borne viral infection, passed along via blood-to-blood contact. And then hepatitis D, caused by RNA virus, which is active only in the presence of hepatitis B. Either it is a co-infection or a superinfection and complicates the care of the patient with hepatitis B. Drug-resistant strains. The discovery of penicillin was a modern miracle, however, followed by multiple strains of drug-resistant bacteria. Examples are penicillin-resistant Streptococcus pneumonia, multiple resistant Staphylococcus aureus, multiple drug-resistant tuberculosis, and extensively drug-resistant tuberculosis. So all of these over the time period have become resistant to our current antibiotics that would kill the organisms. Acute inflammatory response. This is figure 27.5. The process of inflammation occurs whenever the body is harmed. So up here, tissue injury. Immediately on the cellular area, mast cells cause a release of histamine. We get a cellular response. White blood cells are activated. White blood cells bring more people into it. Very simply, diabetes, which allows them to travel into the tissues through little flaps in the capillaries. Chemostaxis. Chemostaxis is chemical signaling that says I need more white blood cells here. Phagocytosis by the neutrophils, they eat what they can. Neutrophil death or pus. Macrophage invasion and cleanup. Now, in a vascular response from the vessels, this is from the cellular response. Vasodilation keeps them in one area, causes redness and heat. Vascular permeability of the endothelial cells as they spread apart. Blood serum and white blood cells leak into the tissue, causing swelling. Increased edema into the tissue puts pressure on the nerve endings and causes pain in the area. and the area is protected, causing loss of function. So it essentially walls off the invading tissue in that specific area. And this would be a combination between the complement system and the actual coagulation system of the body. Systemic inflammation response. System combines with the inflammatory response, and you get the complement system, which the complement system works together with the immune system to attack infections. The kinin system continues the inflammatory response by maintaining the vasodilation. The coagulation system forms a net over the infection site, confining the infection to the certain area. So in complement of one another, all of these systems, one of them essentially targets the infecting invader better. The kinin system keeps them in that one area, so if they're vasodilated, there's no pressure for them to go proliferate around the rest of the body, and then the coagulation system essentially clots them up and binds them to that specific area. History. Hazards of aging are immobility. The body functions best when standing upright. Breathing with the patient lying down has a decreased rib cage expansion. The kidneys drain downward, assisted by gravity. Bed sores, combination of thinner skin, decreased peripheral blood flow, and bed rest can lead to the development of bed sores. Focus history and recent events, hospital discharges, if they have any dementia, or if they have any fractures. An examination, fever of unknown origin, typical sign of infection. The elderly may be unable to mount this response. Focus on alternative signs, sudden onset of confusion or delirium, or altered mental status. In the assessment, delirium, common signs, confusions, hallucinations, and agitation. Temporary condition, potentially reversible. Failure to treat can result in possible permanent injury. As far as treatment, mental dysfunction, eliminate things like hypoxia and hypoglycemia very early. Infection causes oxygen delivery problems. Pulse oximeters depend on peripheral perfusion. Elderly patients may have poor peripheral perfusion. Monitor for hypoglycemia. Glucose administration. Consider dividing the dose or diluting it in order to decrease the osmolarity shift. On transport, use caution when asking the elderly to stand or walk to a stretcher. Blood pools in the chest. Increased venous pooling is sensed by the venous volume receptors, which in turn cause a reduction of antidiuretic hormone and secretions. If the patient stands up and holds their breath to do so, they can get a Valsalva maneuver, which decreases the amount of preload. They can become unresponsive and have an altered mental status from hypotension very quickly. They're not as responsive as they was whenever they were young. Upon evaluation, be sure and evaluate them for systemic inflammatory response syndrome. Cytokine levels become elevated and have a negative effect. They have an elevated heart rate, greater than 90 beats per minute. Alteration in body temperature. Sustained tachypnea, greater than 20 breaths per minute. Low end-tidal carbon dioxide, less than 32. And elevated white count, which we probably won't be able to see in the back of the ambulance. Disposition, golden hour of trauma care. Rapid development of systemic inflammatory response syndrome. Need for rapid medical intervention, aggressive antibiotic therapy in a critical care unit, and rapid transport is imperative. In conclusion, infectious diseases strike patients of all ages. Very young and elderly are at risk for developing systemic inflammatory response syndrome. Paramedic must effectively treat the patient and use the appropriate infection control procedure. References for this chapter were taken from Myers, Professional Paramedic, Volume 2, Medical Emergencies. If you have any questions concerning this chapter, feel free to give me a call. My name is Roy Smith, roy.smith@redlandscc.edu or 405-219-7613. Thank you.